In my 18 years as a board-certified gastric surgeon specializing in digestive disorders, I've performed over 3,000 procedures on stomachs ravaged by chronic inflammation, ulcers, and precancerous lesions. But there's one case that haunts me to this day, and it's the reason I'm making this video right now. Her name was Margaret, a 65-year-old retired elementary school teacher from Tampa, Florida, who walked into my consultation office on a Tuesday morning in March, and when I looked at her endoscopy results, I actually felt my stomach drop, because what I was seeing shouldn't have been possible in someone who, according to her own words, had been eating healthy her entire life. Margaret had severe gastritis, multiple bleeding ulcers, significant esophageal damage, and early signs of Barrett's esophagus, which is a precancerous condition. And when I sat down with her to go through her complete dietary history, what we discovered changed not just her life, but the way I counsel every single patient over 50 who walks through my door. She had been religiously consuming 4 specific foods every single day. Foods that her primary care doctor had recommended, foods that appeared on every healthy eating list she could find online, foods that nutritionists praised, foods that her friends at the senior center all ate together, and these 4 innocent-seeming foods were systematically destroying her stomach lining month after month, year after year, and she had absolutely no idea. I'm Dr. Michael Hayes, board-certified gastric surgeon with 18 years of clinical experience, and in the next 25 minutes, I'm going to reveal the 4 foods that are most likely causing the stomach pain, bloating, acid reflux, and digestive inflammation that's plaguing millions of Americans over 50, and more importantly, I'm going to explain exactly why these foods become dangerous after age 50. What's happening inside your stomach at a cellular level, and what you need to do starting tonight to stop the damage before it becomes irreversible. This is educational content only and not medical advice. Always consult your healthcare provider before making any changes to your diet or health regimen, and individual results may vary. But what I'm about to share with you is based on peer-reviewed research, my own clinical observations from thousands of patients, and the latest understanding we have about how aging affects gastric function. Before we dive into the specific foods, I need you to hit that subscribe button right now, because every single week I publish videos like this that give you the health information your doctor doesn't have time to explain in a 15-minute appointment, and you don't want to miss a single one. Let me take you back to Margaret's story because it perfectly illustrates why this matters so much. Margaret came to see me not because of severe symptoms initially, but because she had been experiencing what she called annoying digestive issues for about 3 years. She would wake up with a burning sensation in her upper abdomen most mornings. She felt bloated after nearly every meal. She had this persistent low-grade nausea that would come and go throughout the day, and she was taking over-the-counter antacids probably 4 to 5 times a day just to function normally. Her primary care doctor had put her on a proton pump inhibitor about a year before she came to see me, and while it helped somewhat, the symptoms never fully went away, and in fact, they seemed to be gradually getting worse despite the medication. When I asked her to walk me through a typical day of eating, here's what she told me, and I want you to pay very close attention because I'm willing to bet that at least half of you watching this are eating a very similar diet. Margaret would wake up around 6:30 in the morning, and the very first thing she would do, even before getting dressed, was drink a large glass of fresh squeezed orange juice, because she had read that vitamin C was important for immune function, and that starting your day with citrus was good for detoxification, whatever that means. Then for breakfast, she would have a bowl of plain Greek yogurt with some granola and berries, because yogurt is probiotic and good for gut health, right? That's what every health magazine told her. For lunch, she typically had a whole wheat sandwich with turkey and lots of fresh vegetables, because whole grains are heart healthy and fiber is important for digestion. And then in the evening, after dinner, she would wind down with a cup of peppermint tea because peppermint is soothing and natural and helps with digestion. 4 foods: orange juice, yogurt, whole wheat bread, and peppermint tea. All of them recommended by health experts. All of them on healthy eating lists. All of them seemingly innocent, and all 4 of them were actively destroying her stomach. Now, I know what you're thinking, how can these healthy foods possibly be harmful? And that's exactly the myth we need to bust, because what most people don't understand What most doctors don't even fully explain to their patients is that the stomach you have at age 30 is not the same stomach you have at age 50 or 60 or 70. Your gastric physiology changes dramatically as you age, and foods that were perfectly fine for you in your 30s and 40s can become actively harmful in your 50s and beyond. And this isn't some fringe theory. This is well-established science that for some reason isn't making it into mainstream dietary advice. Let me explain what's happening inside your stomach right now if you're over 50. Your stomach produces hydrochloric acid and pepsine to break down food, right? Everyone knows that. But what most people don't know is that stomach acid production decreases by approximately 30 to 40% between age 20 and age 60. Your parietal cells, which are the cells in your stomach lining that produce acid, naturally decline in number and function as you age. This is called hypochlorhydria, and it affects somewhere between 20 and 40% of people over age 60, and possibly more if you include people with mild cases who don't even realize they have it. Now you might think, well, less acid means less heartburn and less damage, right? Wrong. Dead wrong. And this is where it gets fascinating from a medical perspective. When you have lower stomach acid, your stomach has to work harder and longer to break down food, which means food sits in your stomach for extended periods, fermenting and creating gas and pressure. This pressure forces the lower esophageal sphincter open, allowing whatever acid you do have, plus bile and digestive enzymes, to reflux up into your esophagus, causing that burning sensation. But here's the even bigger problem. Low stomach acid also means incomplete protein breakdown, which leads to partially digested proteins sitting in your stomach and small intestine, and these can trigger inflammatory responses and feed harmful bacteria that shouldn't be there in the first place. Your stomach also becomes more susceptible to damage from certain compounds in food because the protective mucus layer that coats your stomach lining becomes thinner and less effective with age. Additionally, something called prostaglandin production decreases, and prostaglandins are the chemicals that help maintain and repair your stomach lining. All of this means that by age 50, your stomach is more vulnerable to irritation, more likely to develop inflammation, slower to heal from any damage, and less capable of handling certain foods that wouldn't have bothered you at all when you were younger. So when we talk about these 4 innocent foods being dangerous, we're not talking about them being universally bad for everyone. We're talking about them being specifically problematic for aging stomachs that no longer have the same defensive capabilities they once had. Let's start with food number 1. Orange juice and citrus fruits in general, especially consumed first thing in the morning on an empty stomach. Now, I can already hear the objections. Oranges are healthy, they have vitamin C, they're natural. How can they be bad? And you're right, oranges aren't inherently bad. But here's what happens when someone over 50 drinks orange juice first thing in the morning. Orange juice has a pH of around 3.5, which makes it quite acidic. And when you drink it on an empty stomach, especially a stomach that already has reduced acid production and a thinning mucus layer, you're essentially bathing your vulnerable stomach lining in additional acid at a time when it's least protected. The citric acid in orange juice can directly irritate and inflame the gastric mucosa, which is the innermost layer of your stomach. And over time, repeated exposure to this irritation can lead to chronic gastritis, which is exactly what Margaret had. But it gets worse. Citrus fruits also contain compounds that can relax the lower esophageal sphincter, that muscular valve that's supposed to keep stomach contents from flowing back up into your esophagus. When that sphincter relaxes, you get reflux. And for people over 50 who already have compromised sphincter tone due to aging, adding citrus to the mix is like throwing gasoline on a fire. The research on this is pretty clear. Multiple studies have shown that citrus consumption is associated with increased reflux symptoms in people with gastroesophageal reflux disease, and the effect is even more pronounced in older adults. One study published in the Journal of Gastroenterology found that citrus fruits were one of the top 3 dietary triggers for reflux symptoms in patients over age 55. Another study in the American Journal of Gastroenterology showed that eliminating citrus from the diet reduced reflux episodes by an average of 37% in older adults. But here's what makes this particularly insidious. Most people drink orange juice because they think it's healthy. They're trying to do the right thing. They're following advice they've heard their whole lives about getting vitamin C. And meanwhile, every single morning, they're inflaming their stomach lining and triggering reflux, and they have no idea that the very thing they think is helping them is actually hurting them. Margaret was drinking 8 to 12 ounces of fresh squeezed orange juice every single morning and had been doing so for probably 20 years, and her stomach lining showed the cumulative damage of 2 decades of daily citric acid exposure on an empty, vulnerable stomach. Drop a comment right now telling me what state you're watching from, because I love seeing how far this information is reaching across America, and also let me know if you've been drinking orange juice in the morning, because I need to know how many people are unknowingly doing this to themselves. Now let's talk about food number 2, yogurt and dairy products, especially the kind marketed as healthy probiotic options. I know this one is going to be controversial because yogurt has been positioned as a health food for decades, and yes, it does contain beneficial bacteria, but here's what the yogurt companies aren't telling you. For a significant percentage of people over 50, dairy products, including yogurt, are actively harmful to stomach health, and the reasons are multiple and complex. First, lactose intolerance increases with age. Your body produces an enzyme called lactase that breaks down lactose, which is the sugar in milk and dairy products, and lactase production decreases as you get older. Studies show that lactose malabsorption affects approximately 65% of the global population after early childhood, with rates increasing steadily with age. Now, most people think of lactose intolerance as just causing gas and diarrhea, which it does, but what they don't realize is that undigested lactose sitting in your digestive tract also causes significant inflammation, bloating, and increased stomach acid production as your body tries desperately to break it down. This creates a vicious cycle where the dairy you're eating to supposedly help your gut is actually inflaming it. Second, and this is something that surprised even me when I first saw the research, dairy proteins, specifically casein and whey, can be very difficult for aging stomachs to break down, especially in the context of reduced stomach acid production. When you have hypochlorhydria, proteins don't get broken down properly in the stomach, and they move into the small intestine partially digested, where they can trigger immune responses and inflammation. One study in the journal Nutrients found that dairy proteins were among the most common triggers for what's called functional dyspepsia, which is basically chronic indigestion in adults over age 60. Third, dairy products are mucus-forming, meaning they increase mucus production throughout your digestive tract. And while some mucus is protective, excessive mucus can actually trap bacteria and inflammatory compounds against your stomach lining, preventing proper healing and increasing risk of infection with Helicobacter pylori, which is a bacteria that causes ulcers. Fourth, many commercial yogurts, even the ones marketed as healthy, contain significant amounts of added sugar. And sugar is independently harmful to stomach health because it feeds harmful bacteria, promotes inflammation, and can worsen reflux symptoms. Margaret was eating Greek yogurt every single morning, and she chose Greek yogurt specifically because she thought the extra protein was healthier, but Greek yogurt is actually more concentrated in casein than regular yogurt, which made it even harder for her aging stomach to break down. When we eliminated dairy from her diet completely for 4 weeks, her morning stomach pain decreased by about 60%, and her bloating nearly disappeared. She couldn't believe that something she had been told was good for her gut was actually one of the primary causes of her symptoms. Food number 3 might surprise you even more: whole wheat bread and whole grain products. Now, before you click away thinking I've lost my mind, hear me out, because this isn't about demonizing whole grains for everyone. This is about understanding why they become problematic for many people over 50, and the science behind this is actually fascinating. Whole wheat contains several compounds that can be irritating to aging stomachs. First, there's gluten, which is a protein that even in people without celiac disease can cause inflammation and digestive symptoms. Non-celiac gluten sensitivity is increasingly recognized as a real condition, and research suggests it may affect anywhere from 6 to 10% of the population, with rates potentially higher in older adults. But even if you don't have gluten sensitivity, whole wheat presents other problems. The bran portion of wheat, which is what makes it whole grain, contains phytic acid, which is an anti-nutrient that binds to minerals like iron, zinc, and calcium and prevents their absorption. It also contains lectins, which are proteins that can damage the intestinal lining and increase intestinal permeability, sometimes called leaky gut. In younger people with robust stomach acid production and healthy gut barriers, these compounds might not cause significant issues, but in people over 50 with reduced stomach acid, thinning stomach lining, and decreased digestive enzyme production, whole wheat can be genuinely problematic. The fiber in whole wheat, while generally beneficial for bowel regularity, can also be irritating to inflamed stomachs because it's insoluble fiber, meaning it doesn't dissolve in water, and it can be rough and scratchy as it moves through an inflamed digestive tract. Think of it like using steel wool on already irritated skin. Multiple studies have shown that eliminating wheat, even in people without diagnosed celiac disease, can significantly improve symptoms of functional dyspepsia, gastritis, and irritable bowel syndrome, particularly in older adults. One Italian study published in BMC Medicine found that 34% of patients with irritable bowel syndrome who eliminated wheat experienced complete resolution of symptoms, and the effect was more pronounced in patients over age 50. Another study in the Journal of Clinical Gastroenterology found that wheat elimination improved gastritis symptoms in 41% of patients who had not responded to conventional treatment. For Margaret, the whole wheat sandwich she ate for lunch every single day was contributing to her afternoon bloating and discomfort. And when we switched her to simple proteins and vegetables without bread, she noticed improvement within just a few days. And now we come to food number 4, and this one might shock you because it's something millions of people use specifically to help with digestion: peppermint tea. Peppermint is widely regarded as soothing and helpful for digestive issues, and for some conditions, like irritable bowel syndrome, there is actually good evidence that peppermint oil can be beneficial. But here's what most people don't know. Peppermint is terrible for reflux because it directly relaxes the lower esophageal sphincter, that crucial valve that keeps stomach acid where it belongs. When that sphincter relaxes, acid flows freely up into your esophagus, causing burning, irritation, and over time, serious damage. A study in the journal Gastroenterology showed that peppermint significantly reduced lower esophageal sphincter pressure in test subjects, increasing reflux episodes by an average of 28%. Another study found that patients with gastroesophageal reflux disease who consumed peppermint experienced worse symptoms compared to controls. The menthol in peppermint is the culprit. It has a smooth muscle-relaxing effect, which is why it can help with intestinal cramping, but that same effect is disastrous for the esophageal sphincter. For people over 50 who already have age-related reduction in sphincter tone, adding peppermint is like intentionally breaking the lock on a door that's already barely staying closed. Margaret was drinking a cup of peppermint tea every evening, usually within 2 to 3 hours of bedtime, because she thought it would help her digest her dinner and relax before sleep. Instead, it was ensuring that she would have reflux symptoms at night. And nighttime reflux is particularly dangerous because when you're lying down, acid can sit in your esophagus for extended periods, causing maximum damage. The esophagus, unlike the stomach, has no protective mucus layer, so acid exposure causes direct cellular damage every single time it happens. Now, I know some of you are thinking, okay, but if I can't eat these foods, what am I supposed to eat? And that's a fair question, and I'm going to answer it. But first, I need to bust one more myth, and this is probably the most important one. The myth is this: if a food is on a healthy eating list, if nutritionists recommend it, if health magazines praise it, then it must be good for you. Wrong. Health advice is often generalized, based on younger populations, focused on specific health markers like cholesterol or blood pressure while ignoring digestive impact, and not personalized to age-related physiological changes. What's healthy for a 30-year-old might be inflammatory for a 60-year-old. What helps your heart might hurt your stomach. What provides good nutrition might also trigger symptoms that decrease your quality of life and lead to long-term damage. This is why personalized nutrition based on age, symptoms, and individual response is so much more important than following generic healthy eating guidelines, and this is why I'm passionate about educating people to think critically about the foods they're putting in their bodies, instead of just blindly following advice that might not apply to them. Margaret had been following healthy eating advice to the letter, and it was destroying her stomach. She was doing everything right according to conventional wisdom and everything wrong according to what her aging body actually needed. Now, I need to give you critical information about when to seek immediate medical attention, because while most stomach symptoms can be managed with dietary changes, some require urgent evaluation. Seek immediate medical care if you experience severe chest pain that radiates to your arm, jaw, or back, because this could indicate a heart attack, not a stomach issue. Call 911 immediately if you have chest pain with sweating, shortness of breath, or pain radiating down your arm. Also, seek urgent care if you have difficulty swallowing solids or liquids, vomiting blood or material that looks like coffee grounds, black tarry or bloody stools, unexplained weight loss of more than 10 pounds, persistent heartburn despite medication and lifestyle changes, chronic cough with blood or severe shortness of breath, hoarseness lasting more than 2 weeks, pain when swallowing accompanied by fever, or choking episodes during sleep. These symptoms could indicate serious conditions like bleeding ulcers, esophageal strictures, or even esophageal cancer, and they require immediate professional evaluation. Don't try to manage these symptoms on your own with diet changes. Get medical help right away. Let me tell you what happened with Margaret after we made these changes. She was skeptical at first, especially about eliminating the yogurt and orange juice because she had been eating them for so long and thought they were healthy. But she agreed to try it for 4 weeks because at that point, she was desperate for relief. Within the first week, her morning stomach pain decreased noticeably. Within 2 weeks, her bloating was mostly gone. By week 4, she told me she felt better than she had felt in years. We did a follow-up endoscopy 6 months later, and the improvement was dramatic. The severe inflammation was gone, the ulcers had healed, and the early Barrett's changes had not progressed. She didn't need surgery. She didn't need long-term medication. She just needed to stop eating the 4 foods that were actively harming her aging stomach. Now, 6 years later, she still follows these dietary principles, and she's symptom-free without any medication at all. This is what's possible when you understand what your body actually needs rather than just following generic health advice. If this video helped you, I need 3 things. First, smash that like button because it tells YouTube to show this to more people who are suffering. Second, share this video with anyone you know who complains about heartburn or takes antacids regularly. You could literally save them from years of damage. Third, comment below committing to one specific change you're making tonight, because accountability matters. And if you're not subscribed, what are you waiting for? Hit that button now. Thank you for watching, and remember, this information is meant to empower you to have better conversations with your healthcare team and make informed decisions about your health, but it does not replace professional medical evaluation and treatment.